Let's talk about a vulva self-exam. As a woman, it's so important to know what your personal anatomy looks like. That way, if there's any changes to the color or the texture or the vaginal discharge, you're able to spot things early and communicate that to your healthcare provider. You should do this about once a month. So all you'll need is a small handheld mirror, or maybe a large mirror against the wall, and a well-lit room or a flashlight, and just undress from the waist down and get comfortable in a position where you can clearly see your anatomy. What you're looking at is the folds on the outside called the labia majora, and these have hair. The folds on the inside called the labia minora, which do not have hair. And then from top to bottom, you have the clitoris with the clitoral hood over it, which is a little skin fold. Underneath that is the urethra, where you pee, the vagina, which is for bleeding and sex and babies, and then the perineum, which is between the vagina and anus, and then the anus at the bottom. So you should know what your normal color is, what things feel like the texture, and what your vaginal discharge is, which will change slightly throughout the month. So look for changes in color, such as more redness, or maybe things appear more white. Look for changes in texture. So are there any rashes, or does anything feel bumpy? Are there any new sores, or maybe there's changes to any moles? And then look at your vaginal discharge. Vaginal discharge should be a cloudy white or maybe more clear. It will smell neutral or slightly acidic, and it'll be thick or it'll be thin. So all these are normal and they're changing throughout the cycle. What is not normal is gray discharge or discharge that smells very strong or pungent. So do this about once a month. Know what your personal anatomy is so that you can catch infections early and get them treated.